Hello everyone, I'm Veronica, one of the nurses on 20 North Tower, and welcome to our channel. Today I will show you guys how to set up wall suction. The purposes of this video is to show you how to set up wall suction. Every patient should have wall suction set up at the bedside. However, you may go into your room and you may not have wall suction. Some patients that should have wall suction are dysphagia patients, vomiting, chest tube, seizure, trach patients, patients with NG tubes, RRTs, or codes. Okay, let's get started with the supplies you would need to set up wall suction. You would need a canister container for the wall suction. You will also need a canister bag with tubing. This will already come with the tubing and the canister bag. You will also need a regulator for suction. And you will also need suction tubing. Depending on your type of patient, for which suction device you would need to suction out their mouth or the trach. To suction a trach, you're going to use a French suction catheter. The number right here will tell you what size French to use to suction. To suction their mouth, you will use a Yankauer. And if a patient is going to be on an NG tube, here's your NG tubing. Okay, so I'm going to show you the different parts of your canister bag. There's going to be 3 parts to your canister bag where you're going to hook the tubing up. Okay, so first, on top of the canister bag, you have a tandem, a vacuum, and a patient. Okay, so you want to pop this top into the tandem first. Okay, the suction tubing for the patient is going to go on the patient side, and the vacuum is going to be for the red tubing, and you stick that here with vacuum. Okay, tandem, vacuum, patient. All right, let's get started and set up the wall suction. First, you're going to put your canister to the wall. You slide this back part down into the wall. Okay? Second step, take your canister bag, slide it into the canister, press it down, hear a tight lock. Okay? Push down the tab onto the tandem. Place your red tube into the vacuum. Your suction tubing, your patient tubing. Okay. Here's your regulator. You want to hook it to vacuum. Okay. Press the vacuum in. Turn it to the right to lock it. Lefty loosey, righty tighty. Okay. So then you're going to use your suction tubing. Take your suction tubing. One end is going to go to the bottom of your the vacuum or the regulator, and the other end of the suction tubing is going to go under the canister. Okay, vacuum, canister. Okay, so you want to turn your regulator on depending on your patient order, how much suction you need. In the middle is off, to the left is regular or continuous suction, and to the right is intermittent. So you want to turn your regulator dial to the right to increase the amount of suction. Sorry guys, let's turn it on first. Okay. All right, so let's turn it off for demonstration and let's turn it on. So let's turn it to the right. Okay, so this usually happens sometimes when we set up suction. So we have this. Let's use the yank cower. You hook it up to the yank cower or whatever suction catheter you want to use. And then you test it. It's on, but I don't hear any suction. So what's wrong? So if you don't hear any suction, remember, you have to turn the suction on. There's an off switch and an on switch. You want to turn it up and turn it on. And now you have suction. Thank you guys. Subscribe. Thank you.